Hi, I'm Maveah Griffith, a senior anchor with the National Library of Patient Rights and Advocacy, and thank you so much for joining me today. Today, we are joined by Liz Linden, one of the authors of a recent book on the state of mental health care in the United States. The book is called Harmony in Healthcare: Visions for the Mental Health Care System, published by Patient Press and is available on Amazon. Liz, I'm so happy to see you today. Can you tell us a little bit about yourself, please?
Hi, Maveah. Thank you so much for having me on today. Yes, my name's Liz, and a little bit about myself. I am not a healthcare professional at all. I'm actually just a patient as I'm getting older, but uh, what got me started being interested in working for the magazine is I love to write. And as I said, I'm a long-term frequent flyer of mental health care and also physical health care. My son was born with a spinal deformity called kyphosis, so that started kind of early, and with trying to find out what was happening with him. And later in life, I had what was called cluster headaches, which is a very rare form of headaches. And so it took me a long time to get diagnosed. At first, I thought it was just like a regular headache. And so it took me about 10 years to get a proper diagnosis for that type of headache. And as the years progressed, as I got older, I got very anxious and depressed, maybe just naturally, as it runs in my family, and but also because of these headaches. As people that have a lot of pain, they tend to get anxious and things like that when they're having attacks. So I'm just a long time user of healthcare, and so I'm just very interested in the topic. And again, my writing. So I really have enjoyed working for the magazine.
That's really beautiful, and it was really fascinating to hear about your cluster headaches and your experience with mental health. I'm guessing that's what inspired you to dive into healthcare in the U.S. and write about it.
Yes.
Yeah. Well, have you noticed throughout your research, have you noticed how public perception of healthcare has changed? Like when you were researching historically, did it shift more in the modern days?
Yes, what I've noticed is, well, especially in terms of myself, first I kind of lived in a vacuum thinking this is just me. And I kind of feel that it's true or not, I'm not sure if this is true or not, but I feel like a lot of people have lived like that, being just of the older, that I'm an older X Gen or Gen X person. A lot of people kind of lived like that and just kind of kept quiet. And I would say, like, even older generations was, the kind of philosophy was kind of like keep it to yourself kind of thing. And I really feel like people have opened up so much more about mental health, about physical health, and just have been so much more open about just sharing what's happening with them. And it's just become like just much more open and just not afraid to, I wouldn't want to say whine about it, but just to share your experience and just say it's okay to just say that these things are happening, and just have a dialogue between each other about frustrations that you're having with doctors or expenses or things like that. And you just really learn from each other. And it's just been so much better to not live in this vacuum where you just have to accept what's happening and actually live with for years with not getting diagnosed in my case, which I really would have appreciated living in this day and age as a younger person.
Yeah. And I think I also noticed that type of shift more recently after the pandemic when everybody was more open and destigmatizing mental health. So I'm glad that we can move forward as a society like that. So
Yeah.
has writing this chapter and coupled with your own experiences, has that changed your perspective on healthcare or how medical professionals treat their patients or anything like that?
I've had both ends of the spectrum where some doctors earlier on maybe didn't, because right now I'm on disability, didn't really care to maybe take the time to talk about that, discuss that, or weren't really interested in that, just because it is so actually time consuming to like fill out any paperwork regarding that. And I just really and I just kind of really noticed the shift with some doctors that were really taking more time. And I think it really depends on the doctor that you have. But I've just noticed, a shift as far as that's concerned. But again, some people just have better luck. But as far as I'm concerned, I know that I have the right to ask questions and to be listened to. And I think that comes with from my discussions with other people and just not accepting like, no, your office visit's done at this time in 5 minutes, see you out the door. So I've just become a much better advocate for myself. And I feel that attitude is spreading to other
Hmm.
people, that self-advocacy, because we're talking, so
Yeah.
I feel that's such a positive shift in how people are taking care of themselves.
Yeah, I'm so thrilled to hear about that. I'm really happy that that attitude seems to be spreading right now. In your own personal experience, do you feel like any recent healthcare reforms that were, put into place, if they had been into place when you were having these struggles, do you think that would have changed your situation at all?
I would say, well, fortunately for me, I did have health care for my son. So,
Mhm.
but it was tied to my employer. So I was very much, on top of that, but not so much for myself. So that was an advantage for me. Um, but as we discussed later, for people that are not insured, they will be much more hesitant to seek care because it's going to cost a lot of money.
Mhm.
Depending on what kind of insurance if you have and what type of if it's tied to your employer. But I feel for me, it's sort of worked out well. But in the past, I did have a lot of out-of-pocket expenses for my insurance, and it really depended on where I was at the time. But also, that self-advocacy piece was not there when I was younger because I didn't know about the disorder I had. I'm much more educated now.
Yeah, that's amazing. Um, can you discuss the influence on new health reforms such as the Affordable Health Care Act and how they could have impacted you and your situation?
Well, not in my situation in particular, because I've never taken advantage of that plan uh, because I've always been tied to my employer. So, uh, but I actually wish I was not tied to my particular employer because it would have given me the opportunity to seek employment someplace else. Because what it does is if you are, because I had great insurance and I was tied to that employer, and I would have loved to leave and seek a different job because I was a teacher, and I would have liked to go somewhere else, and it limits your ability to um, be an entrepreneur, go to
Yeah.
a different job, and especially when you're older in age, like I am, sometimes it's harder to get a job somewhere else. So it does limit that. And also, people do not realize that it actually helps the economy in some way, even though as a taxpayer base.
Mhm.
We all might pay into it, but it helps families reduce their own costs. It helps the health of older people, women with children, people with disabilities, and it helps the individual workers that don't have health care perform better at work. So it has all of these benefits that we might not see right now, and we haven't put a dollar amount on. And it really provides this health equity that we really haven't seen in the past. So
Yeah.
it has such a tremendous benefit that I think that some people really see the benefit of, and the others that have had the um, work-tied healthcare are not seeing that benefit because they've always had it tied to the work. But if you have your health insurance tied to your work and you want some mobility, you might be looking, hey, that would be a great, that I wish that was an option for me. Like I had that. It's kind of like you're chained to your work with the when it's coming from your employer.
Yeah, I agree. I agree. Do you think that any research that you did when you were writing your chapters, did they change your perspective on anything regarding healthcare or anything at all?
Oh, one thing I did learn, and I didn't realize that this was a huge issue, that we have a doctor shortage facing us. So it gives me a great appreciation for doctors. Um, and a doctor shortage is going to face all the boomers and people, the older Gen Xers like me. And there's also doctor burnout because they're working such long hours. So the problem's going to increase year after year.
Mhm.
So we really have to incentivize people to actually go into the profession, and we have to treat them like kindly, even though we're frustrated. You go in frustrated for when you're have an illness. We have to actually provide opportunities for them to work less and not such long shifts, because there has been a great resignation for doctors and nurses recently because they're overworked and burnt out. So we are in a crisis right now, and it's only going to get worse. So it's a serious problem that really needs to be addressed, not only in the US, worldwide. So it's a top priority to address that problem.
Yeah, I agree. And that also made me think of the pandemic and how that probably contributed to this problem. Do you think that the pandemic has either for better or worse, has it changed how patients view healthcare?
I'm not sure of all the ins and outs of that, but one thing I felt was a positive about it was the telehealth, that you don't have to go to the office. So I feel like that for services that have continued in that direction, I feel that it's been a great shift, that you don't have to drive to the office when possible. Um, and that might have lessened some of the pressure for some professionals. But again, though, that hasn't really relieved it for emergency room doctors who are still facing tremendous
Yeah,
pressure on the job and still working very long hours and things like that. So it's again great for some of the patients that are able to use those services, but still has not alleviated some of our professionals that are still facing that burnout that we still need to address.
I definitely agree. Lastly, as somebody who's struggled with chronic health pain before, do you have any advice for others who may be going through the same thing and how to advocate for themselves at the doctor?
I would say, in addition to, well, first, get a support group with people that have your same condition. And since mine is a rare condition, I would reach out to support groups online, not just regular Facebook chatting or whatever, but real legitimate support groups. And you can get a lot of, you got to kind of sift through, advice. Don't fall for any like snake oils or anything like that. And, it could just really be support as far as I empathize with your situation. And sometimes you can get some referrals to doctors, good doctors in your area, which I've suggested to some people that I know. Um, and I found a really good support group, and it was just felt so great to actually know that someone has what I have. It was like, oh, wow, it was so validating. Um, and I would say next on that is just be really patient and forgiving of yourself when you have bad days. It's a long haul. Just uh, because I was told like, oh, it's just a headache, and I told myself that, which was very damaging. So now just to have that validation that it's not just a headache was so great for me. It didn't help the pain, but it just made myself feel better psychologically. So I would say, and also getting a great doctor. It took me a very long time to advocate for yourself. Get a great doctor, get someone that listens to you more than they speak. And someone that, you're the person living with the pain, and, someone that listens and takes those notes, really pay attention to that. And so that's my experience.
Thank you, Liz. It was so nice to hear from you. It was so nice to hear your story, and thank you so much for speaking with me today. I'm Maveah Griffith with the National Library of Patient Rights and Advocacy, and thank you so much for watching.